Good day, my dear undergraduate students. Welcome to R.A.T.S in Pathology. The topic for the day is inflammatory mediators. Perhaps Greek and Latin would have been better words. I hope you are able to very fluently and rapidly read what is on the screen. Such will be the fluency with which you can waddle through inflammation. The subheadings on the screen have been divided into two columns. One of paramount importance, which we cannot afford to ignore. Second, the applied aspects of which will help us score more marks. A case history. A woman in her early 30s came with the complaints of incessant cough. On clinically suspecting infection, an antibiotic injection was given. She soon developed a laryngeal stridor, breathlessness, and rashes all over her body. She was rushed to the ICU and a laryngeal intubation was done. She recovered with intensive treatment. What is your diagnosis? And can you explain the plethora of changes that has happened in this scenario? Look at this one. Obviously, the lady is not very comfortable. She is trying to swallow something. At the same time, there is some kind of a redness in the skin, a difficulty in swallowing or even breathing. At the other end, there are rashes, symmetrical, spread all over the skin. Before I go further with the topic, I think it is time for me to tell you people the ABC of emergency. What does it mean? Something that I had learned as an undergraduate student. A for airway. The first thing that we are supposed to do. That is what is being done here, and perhaps it befits the case. B is for breathing. So any of the interference with breathing will have to be sorted out. C is circulation. It can be shock, cardiogenic or various other causes. Disability in the form of seizures or an infarction, intoxication, etc. Exposure, hypothermia, hyperthermia, and there can be critical conditions. So A, B, C, D, E. So these are the first steps to be taken in handling an emergency. And this incidentally is an endoscope. Obviously, in this case, the first thing that the patient would develop will be a laryngeal edema. No matter what we give, this edema might kill the patient. Therefore, a patent airway is mandatory and an intubation has been done. I would very much appreciate if you people can get better explanation from your seniors and the clinical counterparts. One sometimes finds what one is not looking for. Beautiful words. I had read it in some other form. Discovery might be a matter of chance, but chance helps only the mind that is prepared for it. Alexander Fleming. I hope you know this gentleman and the marvelous discovery that he has made, which has saved millions and millions of lives all over the world. And what he has done was, perhaps when he was doing a culture, he had kept it exposed, as a result of which there was some contaminant. And surprisingly, he noted that around the contaminant, there was no growth of the bacteria. And that was the origin of the wonder drug penicillin. Therefore, you find that penicillin can be both a life-saving as well as a life-taking drug, a double-edged sword. Obviously, for a person who is not exposed to it, an intradermal test will have to be done, that is shown in this picture. Again, I think our clinical counterparts will be able to explain, but there is not much of a reaction at the end of 15 minutes. And this incidentally is a picture showing a laryngeal edema. Imagine what will happen if this orifice is getting closed. Another instance is the pulmonary edema. This can happen in a cardiac failure in a case of a cardiogenic shock. And the patient will be presenting with pink frothy sputum that we are seeing. Thanks to web pathology for the wonderful picture. Whatever be it, you find type 1 anaphylaxis is what I am trying to explain, though not in detail now. There can be an allergen, and on exposure to the allergen, there is an activation of the mast cell. There is a production of the IgE. So this leads to the release of the histamine, leukotrienes, thromboxane, cytokines, etc. They are all the various mediators which can act on the various other things, such as the circulatory system and the various other organ systems as well. So obviously you people know the changes, or we shall be touching upon them later on. So the topic for the day is mediators of inflammation or chemical mediators of inflammation. Whether it is for acute or chronic, etc., we need not be confused with. Knowing a bit about it itself is a great ordeal. This is the triple response. The Lewis's triple response, Thomas Lewis. So there is a pink line which becomes more red, and then there is an area of coloration or discoloration around it. Then it becomes white along with an edema. So that is the triple response, which we had seen in our class on the vascular changes. Now, this particular flow diagram is the key for the answer. This is something that we should never miss, and there is a logical sequence with which the student should follow this. Now, there are multiple systems in it. First, let us mention what it is. There is a Hedgeman factor. So there is a clotting system that has been operated. Second, there is a kinin cascade. Third one, there can be a fibrinolytic mechanism. Finally, there can be a complement system. So these four are very intricately interrelated, and they are all associated with inflammation. This will be the prototype that you people will have to follow, and it is not very difficult to memorize this. So factor 12 becomes activated to factor 12A. Then 11, 11A, 10, 10A, 9, 9A, and prothrombin to thrombin. So the clotting cascade proceeds in one direction. At the same time, there is a kinin cascade. Prekallikrein is getting converted to kallikrein. And this leads to the activation of the high molecular weight kininogen producing bradykinin. The fibrinolytic mechanism is also activated, and the kallikrein acts upon the plasminogen to plasmin, and you get fibrin, ultimately the fibrin degradation products or fibrin split products. The plasmin can in turn activate the complement system, and there is again a series of events which we call the clotting or the complement cascade. So this particular one, I would like you people to kindly memorize, do it repeatedly or even write it and try. It is worth it. So the keywords here will be the Hedgeman factor, the kinin cascade, the clotting cascade, complement cascade, and the fibrinolytic system or mechanism. Just take a breath. We are just at the introduction. Almost went into anaphylactic shock yesterday. Apparently, I am allergic to sulfur and had been on a high dosage of sulfur antibiotic for a week. And this is what I had developed. In fact, I remember what my professor of dermatology, Dr. Augustine Paul, had advised. A patient had taken some drugs from the government hospital. Those days, the sulfur used to be the cheapest antibiotic that can be given. And immediately he had developed rashes all over the body. He was illiterate. And what the doctor did was, first thing is, he asked him to mention the word sulfur repeatedly, because he has now come alive. If he were to take the sulfur again, perhaps he will be going in for an anaphylactic shock or even death. So this is a drug-induced urticaria. Maybe it fits in with type 1 anaphylaxis. This is another key diagram which you people will have to follow. This again is from Robbins. Basically, it can be explained like this. This I will be doing repeatedly so that you people become almost well versed with it. There are two sources of the mediators. One will be the cell. Another one will be the plasma, along with it the liver. So liver, there is a plasma. And from this, we will be getting the clotting factors as well as the complement factors. So obviously, there are two sets of these which are being produced. From the cell, you can have the secretory granules. That can be the primary or the secondary granules. Secondary will be the histamine, serotonin, etc. And all this we will be memorizing. So repeatedly, I will be telling you people this. In different forms, kindly memorize it. Nitric oxide, neuropeptides, etc. Exam time. Make it happen and shock everyone with the brilliant answers of yours. It is possible if you prepare it in an orderly manner. There is no chance of haphazard preparation and answering questions like this. Look at it. Look at this again. The mediators of acute inflammation. I always believe in repetition. Repetition in different forms at different days, different time. So basically, there is the plasma protein, the factor 12, the Hedgeman factor, and then there is a complement activation coming from the liver. So this is the kinin system, and then there is a coagulation system. The complements, mainly these are the main things: C3A, C5A, C3B, C5B29. C3A and C5A are anaphylatoxins. C3B is an opsonin. And C5B29 is membrane attack complex, MAC. So here, for the nth time, again repeating. So this is not difficult, but then this is a definite must that you people will have to memorize, explain, and repeat any time. So they can be cell-derived, and they may be either preformed or synthesized de novo. Under preformed, we have got histamine and serotonin. Under the synthesized de novo, we have got arachidonic acid metabolites, AA metabolites, platelet activating factors, nitrous oxide, reactive oxygen species, cytokines, chemokines. So two lists we have got. On the other side is the plasma derived. So from this, there can be C3A, C3B, C5A, C5B29. Then the clotting factors, coagulation system and the kinin system. This should not be difficult when we repeat it, when we divide it, and then learn it sequentially. See again in yet another form. These are the various cells that are associated with the inflammatory mediators. Look, even the epithelial cells can produce the mediators. And there is a mixture of this, so much so it is called the mediators. Courtesy, American Lung Association, Basic Mechanisms and Clinical Management. And look at the series of actions that can happen, which I will be again explaining. This is from the American Lung Association. So bronchoconstriction, mucus secretion, etc. are already there. I had chosen certain diseases as prototypes, one of which is bronchial asthma. This is the respiratory epithelium. It is getting exposed to an allergen. There are various inflammatory cells which are being activated. And this itself is a mast cell. It contains numerous granules. When there is going to be the antibodies are there side by side, they get cross-linked by means of this allergen. There is a contraction and a degranulation. This will lead to attraction of eosinophils also, and there will be various chemical mediators which will be produced, as a result of which you get inflammation, bronchospasm, muscular contraction, epithelial damage, etc. Courtesy Encyclopedia Britannica. That is exactly what we are seeing in the screen. I find that there is a narrowing of the lumen, there is a thickening of the muscle, increased amount of mucus secretion and spasm of the air. Friends or foes? We say that there are various chemical mediators which are produced by the cells. These cells, let us at least understand diagrammatically, the largest one being the macrophage. It has got ruffled ends because it is active and aggressive against inflammation. The eosinophil, more than a binucleated structure, it can be identified by brick red granules. Plasma cell is oval or ovoid with eccentric nucleus, and there can be the antibodies within it. Neutrophil, neutral granules, and basophil, B for blue, bluish granules. Lymphocyte, no granules, but then it can play havoc or save lives. This is the complement system. The next one that we are going to. Complement, there can be two pathways. Always the flow diagrams of mine, please do by heart. That will be the stem of your answer. You have got the classical pathway and the alternate pathway. In the classical pathway, you find that C2b and C4b fragments are produced, and there is an activation of C3 convertase. There is an alternate pathway in which there can be hydrolysis of C3, and there can be the production of fragments such as C3b and C3a. C3b is an opsonin, C3a and C5a are anaphylatoxins. There is another one that can ultimately be produced, which is C5b to 9, which is called the membrane attack complex. It can drill holes into the cells, causing their death. That is what Robbins says. So, look at this one. It is a summary of what I have said. Kindly memorize it and draw the flow diagram and see where it is. This is also called the properdin pathway, which is again mentioned over. So C3 convertase, and there is a surface bound C3b. That is an opsonin. It is sensitizing the cell to a phagocyte. As a result of which you find it can be phagocytose. C3 convertase is another one. You get C3, 5 convertase, C5 convertase, and C3 convertase. You get the active part of it, and you get C3a, C5a. Ultimately, there can be a membrane attack complex. So this particular pathway, kindly memorize. Now, what are the various mediators? Histamine and serotonin, extremely important. They are vasoactive amines. They affect the blood vessels. So there will be increasing the vascular permeability. And they also activate various cells such as the mast cells, monocytes, neutrophils. Vasodilation, permeability, etc. And look at this one. This is what I had mentioned. There is an antibody pair of antibodies cross-linked by means of the allergen. They contract, as a result of which there is degranulation. And it is specific for IgE. Attracts the IgE, which can release the histamine and eosinophilic chemotactic factor. Another one is the kinin system. Exams are pain. Remember pain. Bradykinin leads to smooth muscle contraction, dilation of the blood vessels, and vascular permeability. That is the kinin system. The only antidote to mental suffering is physical pain, calmness. Wonderful thinking. I do not know where they got these. And these are the pathways of pain. Usually pain, there will be an ascending pathway which will be sensory. There is a pain sensation. There are commands which are being given and it is taken to the center, as a result of which there will be a muscular contraction, flexion, etc. The signs of inflammation are shown in this picture. Don't get lost in your pain. Know that one day your pain will become your cure. Probably, I think, is meaning my class. What are the excitatory and inhibitory mediators of pain? This is the list. Excitatory will be prostaglandins, bradykinin, histamine, serotonin also. And these are the inhibitory mediators. So, more than this, pharmacology can be playing a role. This is yet another one, namely the arachidonic acid metabolism. This independently can be asked as a question. I have asked it n number of times in the test. And it is acted upon, the membrane phospholipids are acted upon by phospholipase. And it leads to the activation of arachidonic acid. There are two pathways. One is the lipoxygenase, L-oxygenase. Another is cyclooxygenase, C-oxygenase. Lipoxygenase will be activating the HPETE, and then the leukotrienes. The series of leukotrienes will be produced. Whereas the cyclooxygenase pathway will lead to the activation of prostaglandin H2, and then the other prostaglandins, prostacyclin, can be produced. So also thromboxane A2 and B2. This is exactly replicated again in this. So see what is happening. There is a lipoxygenase pathway, and then there is a cyclooxygenase pathway over here, the cyclooxygenase. There is a third one that has been mentioned, namely the epoxygenase pathway. These three pathways are given over here. Kindly look at it, memorize. As a result of which you find that first, a lot of these prostaglandins can be produced. Their functions are given over here. Their role in inflammation. Then there is the leukotrienes. They can lead to vasoconstriction, vascular permeability, bronchoconstriction, chemotaxis. This is exactly what is happening in bronchial asthma. Thromboxane A2 can lead to vasoconstriction. All the other prostaglandins can lead to vasodilation. See what is happening in a case of an asthma. There is the respiratory epithelium. There can be a denervation or de-epithelialization. The nerve gets exposed, and then there is an allergen, various inflammatory cells. They are all being activated. The nerve goes to the muscle bundles. There is a contraction, and then there is a cholinergic reflex. Also, there can be dilation of the blood vessels, increased amount of mucus secretions, and it can play havoc. To put it very simply, it is like pushing a man's head underwater, and he will be suffocated. His nose and lungs can no longer take in air. That is the horror of bronchial asthma. Of course, it can be cured. See this over here. So I'll be dealing with in detail, or it has already been dealt with under the topic of bronchial asthma. But see, there are certain structures. So this is a cast. A cast is a structure that befits the outline. During Vinayaka Chaturthi, you find that you get a cast of Lord Vinayaka. Similarly here, you get the mucus plug, which is a cast of the respiratory system, or the tracheobronchial tree. And sometimes there can be spirals over here called as Kirschmann spirals. There can also be some crystals called as shark outlet and crystals, and there can be the epithelial cells. And look at the abundant amount of mucus that is being produced by the respiratory epithelium. Normally, this doesn't happen. So much so the person is immediately put on a bronchodilator. He knows how to survive. Today, it is a very common affair, and these people carry the lifesavers. These changes, I had already shown you, worth repeating any number of times. I would like you to appreciate the difference between these two. The mediator between the head and the hands must be the heart. A great epigram, Metropolis, 1927. And finally, the mediators of inflammation. You people know Cala, Dola, Ruba, tumor, etc. And finally, the functio lisa introduced by Rudolf Virchow. My professor used to say, as soon as inflammation starts, so does healing. So the mediators solve the problem, and they are not simple meditators. Thank you for your patient listening.